All right, um, let's get started. Hi, everybody, and welcome to Dance NYC's Fieldwide Call. My name is Nadia Khairallah, and I am Programs and Advocacy Coordinator at Dance NYC. I'm joining from occupied Lenape and Canarsie land, also known as Brooklyn. As a visual description, I'm a light-skinned Arab person. I have short dark hair, and I'm wearing a black vest. And my background is an orange and pink gradient Our New York City dance banner. And my second screen is over here, so if I seem like I'm looking at you less, I'm actually looking at you more. Please note that we'll be recording today's call. Live captioning is available today. We have a captioner from the Viscardi Center. You can use the CC button in the bottom of your Zoom screen to view captions. And we've dropped the link in the chat to access the stream text transcript where you can follow along as well. We also have ASL interpretation provided by SignNexus, and you can pin the interpreter's videos by using the 3 dots in the corner of their screen. The Fieldwide Call is a space for the dance community to gather, share resources, and collectively act on pressing issues for the future of dance in the NYC metropolitan area. Today, as part of the Our New York City Dance Advocacy campaign, we're focusing on healthcare for dance workers. I don't think I need to explain to everybody why this is a really important issue, but I will anyway. Healthcare is a human right, but unfortunately it's not a given in our field. According to our 2023 State of Dance report, 37% of dance workers do not have medical insurance coverage, 59% do not have dental coverage, and 82 do not have access to mental health care. The systemic exclusion of independent and freelance workers from healthcare coverage is a policy choice, but it doesn't have to be that way. Today's speakers will offer both short and long-term solutions that can get us closer to healthcare for all dance workers and ultimately all people. First, Melanie Dorigo from the Campaign for New York Health will share how dance workers can plug into the movement for universal health care in New York State. While we work towards universal coverage, portable benefits have the possibility to extend healthcare access to more freelance workers. Andrea Gordillo from the Freelancers Union will discuss this potential. Finally, Jonathan Gray from the Freelancers Union will highlight resources to help freelance workers navigate the current healthcare system. Each of our speakers will pause for Q&A after their portions. I'm really excited to get into it, but first I'm going to ground us with some community guidelines and a land acknowledgement. As a general note for accessibility, please be clear, loud, and maintain a moderate pace while speaking for both the captioner and for general understanding. Please stay muted unless you are speaking. If you are speaking, please introduce yourself and your organization if applicable, and if you're on camera, please give a short visual description, kind of like I did at the beginning of when I started speaking, for accessibility purposes. If you have a question, you can put it into the chat, or you can raise your hand during the Q&A sections. If you have individual questions or concerns, please send a direct message to Melinda on chat. Some community guidelines for today. By participating in this event, you're entering a virtual space of learning and accountability based on Dance NYC's values of justice, equity, and inclusion. This means we agree to share our opinions respectfully and course correct if harm is caused, to honor everyone's humanity, to not tolerate speech that is disparaging, abusive, or violent, and if anyone acts in violation of these guidelines, they will either be asked to course correct or they'll be removed. Thank you for your collective agreement. Dance NYC would like to acknowledge that the City of New York is located on stolen land, more specifically Lenapehoking, the traditional territory of the Lenape people, who are also recognized federally as the Delaware Nation of Oklahoma in Anadarko, Oklahoma, the Delaware Tribe of Indians in Bartlesville, Oklahoma, the Stockbridge-Munsee Band of Mohican Indians in Bowler, Wisconsin, and in Canada, the Munsee-Delaware Nation in Muncie, Ontario, Delaware Nation in Moraviatown, Ontario, and Delaware of Six Nations of the Grand River in Oswegan, Ontario. The Lenape people are the original inhabitants of this land and gave Manhattan Island its name, Mannahatta. We recognize that as an organization based in NYC, We've benefited and continue to benefit from the systemic displacement and subsequent erasure of Lenape people and governance on their land, and must make concerted efforts to collaborate and make pathways for Lenape artists and leaders to return to Lenape Hoking today. Please join me in taking a moment to recognize and reflect on the centuries of violence, displacement, forced migration, and settlement here, and consider what reparations you can begin to make today. You can begin by supporting Lene Lenapek's Kweyok, a group of Lenape matriarchs from 5 of the federally recognized Lenape tribes who are working to increase Lenape presence in Lenape land, both immediately and long term. We're going to drop a link to their website in our chat, and you can make a donation and just take a look at some of the work that they do. All right, I'm now going to turn it over to Melanie from the Campaign for New York Health.
Thank you so much, Nadia. It's wonderful to be here. My name is Melanie Dorigo. I'm the Executive Director for the Campaign for New York Health. I'm an Irish American with dark blonde hair. I'm wearing a black blazer, and I am in front of a black and white background. I'm very excited today to be here to talk to you about the New York Health Act. Just a quick note, I'll be using presentation slides that are in the colors of red, navy, and beige. These slides will feature text, bold, empowering graphics, as well as graphs, but I will describe the graphs as well as the graphics when I get to them. So thank you again so much. Let me go ahead and start to share my screen. Oh, great. So as I said, we're here to talk about the New York Health Act, which is the state-based single-payer healthcare bill in the state of New York. So quickly, just to set the agenda, I'm going to very quickly talk a little bit about the state of healthcare. Then we'll get into the New York Health Act. We'll talk about how it works, who it helps, where we are in passing it, how you can help, and then we'll take some questions. So first, our current healthcare system. I'm showing a slide right now that depicts a graph of healthcare spending as a percentage of gross domestic product from 1980 to 2023. If we look to the left side of the graph, you'll see that it starts in 1980, and this is a line graph. And you'll see in 1980 that most of the countries participating here are relatively close together from a spending stance. The U.S. still is at the top of that spending, but they're much closer together than if you look at the right side of the chart, which of course is 2023 here. That single red line at the very, very top represents United States healthcare spending. So what you can see is that we have pulled much further away from the pack of other high-income democracies around the world. So you might be thinking, well, hey, if we spend the most, then wow, we must have the best healthcare in the world, right? And unfortunately, that answer is no. We are number one in spending, but unfortunately, we are not number one in health outcomes. Study after study has proven that Americans actually live the shortest lives, and we have the most avoidable deaths. We can probably spend a day and a half parsing out the worst health outcomes or the worsening health outcomes in the U.S. compared to other democracies and high-income democracies. You may or may not be aware that the U.S. is actually the only developed country in the world that does not have a universal healthcare system. So when we look at what are these differences, what makes us so unique that we're spending all this money, but we're still underperforming from a health outcome stance. And that you quickly becomes quite easy to narrow in on the fact that we are the only developed country that does not have universal health care. We do not prioritize universal health care for everyone in this country or in this state. And unfortunately, it is individuals like us that are paying the price. So what I want to talk to you about now, just sort of briefly, is what does that mean for New York, right? It's one thing to talk about the big picture, to talk about the woes of the country, but we're a very, very large country. So what does it mean for New Yorkers? Well, unfortunately, in New York, it means that 740,000 New Yorkers have medical debt. 45% of New York adults have encountered one or more cost-related barrier to getting health care, right? And that could look like not affording medicine or having a chest cough and being afraid to go to the doctor because they don't want to get hit with hundreds of dollars in medical bills. I think most of us either have been there ourselves or know someone, right? And unfortunately, this number is climbing. Also, 76% of New Yorkers report being worried or very worried about affording healthcare in the future, which is no wonder, right? Because the one thing that we can count on when it comes to healthcare is that those costs are always going to increase. But what this means, sort of to sort of sum it up in a very simplified way, is that healthcare is and will continue to be too expensive for the majority of New Yorkers, right? Too much of what we're paying goes toward insurance companies, right, to their profits, to their bottom line, instead of going into actual care. And as I mentioned, every single year, these insurance companies demand more and more of our money as they cover less and less. And unfortunately, it's getting worse. Last July, the federal government passed the reconciliation bill known as OBBA, which resulted in billions of dollars in healthcare cuts around the country. What this looks like for New York is that we will unfortunately be on the receiving end of nearly, if not more, at least 1.5 million New Yorkers are going to lose their health coverage. In July 1, so next week, we know that 470,000 New Yorkers are going to lose essential plan coverage. The remainder of that estimated 1.5 million will start to take effect in January of 2027 when new Medicaid requirements come into play that are arduous and unnecessary and designed to kick people off coverage. These federal attacks also mean that we will eliminate thousands of jobs in the state. It also means that health center and hospitals will close. Even before this reconciliation bill was passed, close to half of New York's hospitals, a little under, were really sort of operating in the red. Many hospitals and health centers rely on Medicaid money to stay open, to keep their doors open, to keep serving populations, right? So you can imagine what this looks like for safety net hospitals, for rural hospitals, who are likely going to either close altogether or certainly close down wings, which we know is already happening, right? I'm sure if we have some conversations with family members, maybe in our own communities or in communities around the state, we learned that obstetrics was removed from the hospital, right? That the cardiac wing has closed down, oncology has closed down. So what does that mean? That means those folks still need care, but now they have to travel longer distances to get it, which of course, results in a higher risk for those patients, and it could mean longer ER wait times for those communities and counties where those hospitals remain open. And in addition to that, which seems almost like a gift compared to the real horror that will await many patients, is that every New Yorker will experience skyrocketing premiums. We saw the first wave of this, in the fall when ACA subsidies were not extended, and premiums in some cases tripled. And so what that resulted in was New Yorkers foregoing healthcare altogether, and that really starts to set up a powder keg for us here in this state. So as I said, quite simply, what this means is that our healthcare system is designed, right? And let me be very clear about that. It is a design. It is not a flaw. It is a design in the system for insurance companies to maximize their own profits, right? And it's not just insurance. In some cases, it is large hospital conglomerates. It's pharmaceutical industries, right? They are prioritizing their bottom line over the health of New Yorkers. And I want to be very clear about this. Insurance companies are a business. They are very good at their business. But don't for a second be fooled into thinking that their business is about providing healthcare. Their business is about making money for their shareholders. And so that leaves us in a precarious position as New Yorkers, right, who are trying to navigate and get healthcare for ourselves and for our loved ones and for our families. Because it often results in our care continually going up every single year, driving many of us into debt, foregoing necessary treatment, or foregoing our medicine, all due to the very cost of health insurance. And of course, as I mentioned, this reconciliation bill has really poured gasoline on an already untenable fire. This bill will more than double the population of uninsured individuals in our state, and those costs will continue to skyrocket. Now that I've laid and taken care of the gloom and doom portion of the presentation, I want to show you the silver lining. There is a solution. We don't have to lay down and take it, not here, not in New York. We can demand that our state government step up and fight back against a federal government that seeks to do us harm. And they can do that by passing the New York Health Act. So let's talk about what the New York Health Act is. As I mentioned, it's single payer healthcare for every single New Yorker. This means it's comprehensive, it's upgraded, and it's guaranteed for every single New York resident and full-time worker in the state. As we like to say, everybody in and nobody out. So what does it cover? It covers all medical, all dental, all vision, all hearing, all your prescription drugs, and long-term care. And I did put a few extra bullets here, right? Because I know we always get these questions. Well, what do you mean by medical? We mean all medical. That's mental health, your reproductive care, your substance abuse, your specialty, your primary, all of it. Hospital care, all of it is covered under the New York Health Act. What's more, it saves you money. Under the New York Health Act, there will be no more premiums, no copays, no deductibles, no prescription costs. Most New Yorkers would save thousands of dollars every single year. How do we do this? By cutting out the waste. There is a tremendous amount of waste in our current system. And I know it can be hard for us to wrap our heads around, well, how are you telling me it's going to cost less and you're going to give me more? It doesn't make sense to me, right? But that's because we're just really not aware of the tremendous waste that is in the insurance system. There's a ton of administrative waste. I'm going to talk about that. I'm going to show you in a chart in a moment. But what we do know, study after study has shown us that the New York Health Act will save billions and billions of dollars every single year, and it would save over 92% of New Yorkers in healthcare costs. Many of the studies show as high as 96%. And my favorite part is that it saves thousands of lives every single year, right? And that means that we get to get the care that we need when we need it. We get to visit the doctors that we choose, not the doctors that our insurance company chooses for us. So how does it work? I'm going to go through this quickly because I am mindful of the time. This is a graph that is kind of a intentionally busy graph. There's a graph on the top and a graph on the bottom that is depicted by emojis, right? And so a very simplified version of our current healthcare system. And I want to stress it's a very simplified version. So a sad face emoji, we pay for our health insurance. We get sick emoji, right? We visit our in-network doctor. We've got to make sure it's in-network. Otherwise, we're going to get banged with more cost, right? Or we have to go to an in-network hospital. Then we pay our copay, or we pay money until we reach our deductible. Then let's say we need additional care, right? Then our doctors have to go back and forth with our insurance companies trying to get approval for care. If it gets denied, it's a whole process. They may have to figure out an alternate course of treatment or keep fighting. Finally, we get the care that we need, we get the approval, and then you know what happens? We get to pay even more. We get to pay more copays or more expenses until we meet our out-of-pocket max. Whew, that's like a tongue twister, right? But the bottom of the graph depicts a much simpler world, one that actually operates everywhere else around the globe. We get sick, little sick emoji. We get to visit the doctor or hospital that we choose. Again, not the one that our insurance company chooses for us. And then you know what happens? We receive the treatment we need, and then we get to go home. Sounds like a much better world. Sign me up, right? So now we get to this point where everyone's starting to feel pretty good about the New York Health Act, and they say, yeah, that sounds great, but how do we pay for it, right? So we're going to dig into that briefly here. But instead of paying insurance, deductibles, copays, etc., The New York Health Act, it will be paid for by a progressive tax in combination with federal monies, right? And so what that looks like is that we're paying our fair share, right? And remember, I said over 92 to 96% of New Yorkers pay less than they're currently paying. So does that mean that, the billionaires that are buying our elections and, creating the laws that we live under have to pay more? Yes, it does. But it also means that everyone wins because everyone, from the billionaire to someone who makes zero money to a child, everyone in between gets high comprehensive and upgraded healthcare with more benefits than any other plan in the nation. So I'm going to quickly talk about this chart here. This next chart really digs into how exactly is it paid for. So on the left side of the chart, there are some red graphs, right, that show where the savings come from. And I'll just quickly let you know that this was based off of a Rand Corporation study that was done in 2018 that showed that that the New York Health Act specifically, but of course they've done many single payer healthcare analyses, but a New York Health Act bill would reduce healthcare spending in the state. So what we see is under the New York Health Act, we would reduce insurance administrative costs by 7.5%. We would reduce hospital and doctor administrative costs by a little over 5%. And we would reduce the price of drugs and devices by over 5%, for a total savings of close to 18%, which, what does that mean? Well, that looks like $63.2 billion in savings. That's a lot of savings. But what I like to say is that the New York Health Act is not just about saving. It's also about reinvesting back in New Yorkers. So remember I said there's no more copays, no more premiums, no more payment, right? So there's a cost to that. And so we put that back into the system, which costs a little under 5%. We also improve provider fees because we want to make sure doctors are whole and hospitals are whole and they can stay open. So we invest in New Yorkers that way. We also add long-term care to make sure that every New Yorker from cradle to grave is covered with comprehensive benefits. And so that is a bit of an investment. But even with those incredible investments back into New Yorkers, we're still saving nearly $17 billion a year, right? That's how much administrative waste is in our current healthcare system. So that is how we pay for it. So quickly, who does it help? Well, it helps unions, right? Their healthcare is covered. Union members no longer have to fight for healthcare, which is really what everything is coming down to these days. Instead of sacrificing, increased wages or worker safety or time off, they get to actually fight for those things because they will have the best comprehensive healthcare, better than any current public union plan today. It also helps safety in rural net hospitals, right? I told you a few moments ago that many of these hospital systems are going to close down. By passing and implementing the New York Health Act as soon as possible, that will keep the doors open. It also helps small businesses, right? Small businesses no longer have to compete with large corporations and their robust health plans. They'll be able to recruit talent, to develop talent, to retain talent while lowering costs for healthcare. And property taxpayers. Now, I'm not going to go too much into this, but I do just want to mention we just had a world-renowned health economist do a study on the New York Health Act, and they looked at how much would counties, municipalities, and school districts save under the New York Health Act. And frankly, the savings were astounding. Counties would lower their healthcare costs by 90 to 95%. Municipalities and school districts would lower their healthcare costs by 80 to 85%. This means that our current system is leaving billions of dollars on the table in New York. New York City alone would save $13.6 billion in healthcare costs. Imagine what that money can do, right? Imagine what that would do for our communities. And that money could either be reinvested back in our communities, some of it could go to property tax relief, or a combination of. It's actually fiscally and morally completely irresponsible to not pass this bill. And then lastly, who does it help? It helps all of us. It helps every single New Yorker, right? Everyone's getting better healthcare. No one has to worry. No more medical debt. It's really, frankly, we're very behind the pack globally, but it is where we need to move if we believe that if we believe that healthcare should be a right. And even if you don't believe that, if you believe that you want to get more for your money, this is the bill. This is the bill for you. Okay, so where are we in passing it? Well, the New York Health Act was reintroduced in the legislature in January of 2025. It will be reintroduced again in the new session in 2027. Currently, we have 77 co-sponsors in the Assembly and 34 co-sponsors in the Senate, which means we have a majority in both chambers. What stands in our way is political will. We need to build the largest healthcare army to really pressure legislators in marginal purpley districts and leadership, as well as the governor. I think this new white paper that was just released last month is going to go a long way in those particular districts and with leadership. We need to make them see that we demand this, and it's frankly absurd for them to oppose it. There's a lot that stands in the way, always lobbyists, historically lack of awareness, and historically political priorities. But with these federal attacks, we know that healthcare is now a number one issue. So this is really our time to run the table and finally move this bill over the finish line. So how can you help? Well, we would love for your organization to endorse the New York Health Act. We have hundreds of organizations around the state that have endorsed the campaign. We would also invite you to join our coalition to help us strategize and move the needle and make sure, as I said, that we can finally pass this bill. Individually, we invite you to lobby with us. We have various lobby days throughout the year. We also have regional hubs working and organizing locally, anchoring our New York Health Act organizing in various regions. I'll send some information about that if anyone is interested. And then, even if your organization is unable to participate, we welcome individuals to participate in our coalition. We would love to have you. So with that, let me get to some questions to see if we have anyone who has a question. I'm also happy to put my email in the chat because I know that questions will come up later.
It looks like we have a question in the chat about whether this would cover New Yorkers. I assume like getting medical care outside the state, like if I break a bone in Connecticut.
Oh, yeah. As long as you're a resident of New York, and I'm sure that when this bill is implemented, maybe everywhere is different, right? Sometimes it's like, as long as you live in New York for 6 months, you're considered a resident. Sometimes it's 8 months, as long as sometimes it's just your primary residence. Yes, if you're traveling, if you're on vacation, if you're a snowbird, New York Health Act will cover you 100%.
I also see in the chat, how do we endorse the campaign as an organization?
Yeah, I can send you some information. We have a form. It's very easy to endorse our campaign. I will send that over to, I can send that over to Melinda. Absolutely.
Yeah, and Melanie, I think it would also be helpful if, while we move on, if you can drop some links in the chat for people to
Absolutely.
send, and then we can also give some time at the end of the call as people are logging off to put those back up so people can take action.
Absolutely. And I'll monitor the chat. If any questions, folks can just direct them at me and I'm happy to answer them as well.
I see also another question from Janet Wong in the chat, but is the insurance industry up in arms against to fight this? And what is the strategy against their immense power?
Yeah, yeah. So they will be. I think right now the insurance industry really believes that they've got a lock on our political system. And frankly, history would prove them right. Pretty much anytime they write a big check, they get what they want. So they will be a huge force once they know that we're moving, right? And so there's sort of a several pronged strategy here. The first of which is it's a gift to be underestimated, right? I know sometimes people look at that as a negative. I don't. I think look no further than the mayor of New York City, who is grossly underestimated and toppled, a political billionaire class. So what we need to do now is really make sure that, and we are doing this, but we always welcome the help. We're building in every corner of the state to build the largest healthcare army possible. And we need to do that under their noses to make sure that we are ready to go to fight back, that we own the narrative, right? That we are organizing, making sure people know what this bill is before they start to twist it, because they will. We're also meeting with new partners to diversify our coalition. We want to make sure that we are the largest, strongest, most diversified coalition that the state has ever had in terms of fighting against the corporatization of healthcare. So that's well underway. You know, we're moving more and more unions under our belt. We're moving large organizations that have a lot of power in Albany. We're in talks with them, so we're going to continue to do that. And the fact of the matter is, as we bring in those more powerful coalition partners, those are folks that are going to have more money to fight back. So that's sort of where we're at, and I'm certainly happy to sort of talk more. But you're right, that is absolutely, it's going to be the fight of our lives. But I do believe that we can win. If people were ever having a moment in politics, it's this timeline. It's where we are right now, which is why I think this time is our window of opportunity. It's why it's so special for us. Unfortunately, you know, our federal government has chosen harm, and it has really just created this powder keg where, unfortunately, people are going to die, and they're going to die at the hands of our government. And you know, we can't let those people die in vain. So we've got to do everything that we can to, as I said, move the needle and move this bill over the finish line. And I do think that we can do that.
Thank you so much, Melanie. I know there's probably more questions about getting this passed in the political process. So if you could drop your email in the chat, and people can
Absolutely.
follow up and continue the conversation, that would be amazing. And now we'll welcome our guests from the Freelancers Union, Andrea and Jonathan.
Sounds good. Thank you, Nadia. And thank you, Melanie, for the great presentation. This is a great segue into our different initiatives and resources for the dance community here. I'm Andrea. I am the new executive director of the Freelancers Union. I'm a tan skin Latina woman with black curly hair. I am going to share a little bit more about a pilot initiative that we are initiating this year. But first, I just wanted to give a little bit of context to the Freelancers Union history, which I think is really relevant to today. The Freelancers Union was founded 30 years ago as an insurance company for freelancers who, as probably everyone on this call knows, are exempt from employer-sponsored healthcare plans. And so when the passage of the ACA happened, the Freelancers Union Insurance Company became more or less defunct and sunsetted. And obviously now, as you all learned through Melanie's excellent presentation, a lot of the kind of healthcare coverage that came with the ACA is still at risk, right? And there were still structural issues with that. And we at the Freelancers Union continue to see freelancers as like canaries in the coal mine as it relates to the very, very enormous issue of healthcare in this country. So one of the initiatives that we pursued is the idea of portable benefits. And something like Social Security is an original type of portable benefit. It's something that everybody has access to, regardless of your circumstance. And so we are looking to pilot some version of this at the city, or take kind of inspiration from these New Deal era type of programs, and kind of fill some gaps. So I'm going to talk a bit more about this pilot initiative that is meant to be an experiment and a study. And then I'll let Jonathan talk more about our current insurance offerings for any of you who are having insurance challenges now. And we do operate a freelance insurance brokerage. And I'll let Jonathan talk a little bit more about that. So I'll take about 10 minutes or so to go over this pilot that is being introduced by the city council in the next couple of months. So what you're looking at is a slide presentation on the Creative Workers Health Fund. And I'll skip over a lot of these because I think a lot of people in this room kind of understand what's at stake and why the time is now to do something like this, as well as some of the um, numbers around the creative economy in particular and how much it's at risk because of the affordability crisis. So let me skip through some of this. Also, just to note, there, per the Center for Urban Future, there's a significant shift and uptick in freelance work. So this is another rationale behind taking a look at how we can provide the healthcare coverage for freelance workers through the city. And also noting that, New York City is like the 8th largest economy in the US. So although the state has a lot more power, and how Melanie was explaining a lot about the kind of regulatory changes we're pursuing through the New York Health Act, some experimentation at the city definitely has a lot of application in a lot of other places. So we took some time to assess what could be some innovations here. And we really wanted to hold the city to a standard as a model employer. And so we are looking at a large group of creative workers who are paid by the city, and those are teaching artists. There's an estimated 11,000 of them in New York City, a lot of freelance workers. And so this is a little bit about how teaching artists access or do not access health insurance. And again, we were just outlining how they are a strategic workforce for change. So taking inspiration from portable benefits to support health expenses for independent workers. This is meant to support individual workers across many different contracts and provide essential support directly to workers. So how this pilot will work, and another preface, this is still being introduced currently by the City Council, so you're getting a little bit of a sneak preview at this, but we do expect to hold hearings and rally support around this. So just some additional context there. The Creative Workers Health Fund pilot would be administered through a designated city agency and through a qualified nonprofit administrator. So we get a lot of questions about, the eligibility. Obviously, many of you might also teach in schools, I'm assuming. So some of you might qualify for this. So the eligibility of how we're approaching this is that you'd need to be working on a city-funded contract, working at least 90 days under a covered city agency, and not otherwise receiving employer-sponsored health insurance. It would rely on specified contributions to distribute the funds through a qualified nonprofit administrator. We're also, as I mentioned, going to engage in a study to kind of track its progress and impact. And then this is a little bit, this image on this slide sort of shows like how all of the funding would sort of flow directly to a teaching artist. And we're structuring it in a way where, let me go to the next slide. How the fund would work would be that the contracted city nonprofits, the city itself, and the teaching artists would pay into a fund that would then be able to use for their health expenses. And so this is a little bit of a snapshot on how this might kind of look like. So if someone, say, is making $25,000 in freelance work, they'd be allotted $2,400 for the purchase of an individual plan on the ACA marketplace, but a range of other insurance products that they might need too, right? Some other it can be a lot of other products, short-term disability that can help assist with any sort of paid leave. A lot of I should also say that we're looking at this as something beyond just like a health fund as well. It's also a kind of a social safety net. So folks who need to take some kind of paid leave might be able to access that through this fund, through a flexible fund. So this is just some of the innovations that we're expecting, or yeah, we're expecting to see through this pilot. Immediate support for our teaching artists, portability across employers, and a shared funding responsibility. We really want to compel the city and private employers to provide what is a human right to people, and we want to start with exploring the capacity through this project. So chiming in urgency, you are all very well aware of why this is needed. And I think I'll just leave it at that. This was a little bit more about what success would look like in the future. And obviously it is just the beginning of one piece, right? Freelancers are 1 in 3 Americans are freelancing. So we expect to kind of use this as a model to change more broadly across the state and across the nation. So that was quick. I tried to keep it quick and give Jonathan 5 to 10 minutes to talk about some of our current insurance offerings, and also answer any questions for you all.
Great. I guess I could take over, Nadia.
Yes, you're spotlit and ready to go.
Fantastic. I'm Jonathan Gray. I'm the Director of Member Benefits here at Freelancers Union. I'm a Black man. I'm wearing a Black Selena t-shirt. I'm currently in the photo hub. Yeah, so here at Freelancers Union, I don't have any presentation slides. I'm just going to talk and freestyle it. Yes, Selena. Yep. So here we offer a lot of great benefits for freelancers. I like to say that I'm like an HR back office for freelancers, where you can come here for support for what you need for your benefits. So currently we offer health insurance, dental insurance, liability insurance, disability insurance, term life, and vision. On this call, as we know, as we say, that health insurance is one of the biggest issues that freelancers face. So what we did here at the union was kind of seek out different insurance carriers, companies, and even access to healthcare for our members here at the union. For instance, we have a plan called Solo Health, which I don't know if you guys are familiar with. I can put all of these links in the chat when we're done as well for you to review, which is a great partner of ours, where it provides nationwide access to an in and out of network PPO type of plan. However, there is a caveat to that plan where you would require medical underwriting. So sometimes if you have pre-existing conditions, you can be disqualified from this plan, unfortunately. We're also working on partnering with a new health group where they provide some type of healthcare access for $50 a month or $125 a month, which would give you unlimited telehealth, unlimited mental health, and some in-office visits under the United Healthcare Choice Plus network. And just thinking about it, we talked about health insurance so much, but we also have to think about protecting our income as well. With that in mind, we do offer a group long-term disability option through Guardian, and as well as liability insurance, which could be very important for dancers. For instance, if you're teaching a class and someone gets hurt because you're instructed to do a certain move, and they try to sue you, you would be able to use this coverage to protect your income. And I'll just leave it open now for any questions that anyone may have.
Okay, I think I saw a question from someone in the chat how we can help. I would say just make sure to stay, if you're not already a member of the Freelancers Union, to join us. You can do that on our website. I'll drop it here.
And
freelancersunion.org.
it's free to be a
Yeah,
member.
it is free to be a member. It's free to join. But you'll be able to kind of tune into the cadence of our advocacy push around this. I expect later this year we might have some hearings. So any of your experiences are always valuable to submit testimony. And we'll just keep you posted on how you can support. But being a member of our union really helps us a lot when the time comes for advocacy.
And I would also like to big up our new legal department that we have as well. So if any freelancers in New York are facing any non-payment issues, you're actually able to reach out to us and we can help you out. Any other questions, anyone?
Yeah, I actually have a question. By the way, this is Melinda. I didn't do a visual description earlier, so I can do one now. I am a Chinese American person. I have dyed red hair. I'm wearing an orange jacket, blurred white background. So Andrea, you shared a little bit about kind of this pilot for a portable benefits kind of shared healthcare fund for teaching artists, which I know a lot of people in the call are teaching artists. I think a little over half of dance workers are educators. And a lot of those people are teaching artists that are contracted with the city. But the question I had is, I know that this is like taking place within a larger conversation around portable benefits as one model to support freelance workers. While we're working on trying to get universal healthcare access, both with healthcare and also with other benefits like retirement, with other protections that folks need. But I'd love to hear if you're able to provide some context about what those conversations have been looking like.
Um, you mean regarding kind of like both the conversations regarding like both the alignment of universal healthcare with portable benefits, or portable benefits like larger?
Just larger portable benefits, like what kind of where is this model coming from, and how did this kind of pilot come to be for you all?
Yeah. Well, the freelancers union, like I alluded to earlier, created the freelancers insurance company back in the 90s, and concurrently founded something called the Portable Benefits Network. And I think like I mentioned, freelancers union or freelancers don't just have um a struggle to get healthcare coverage. They also, don't have the same sort of access to pensions or 401ks, or paid leave, a whole bunch of other social safety net that a lot of people get with full-time employer kind of models. So that's sort of the kind of background on how this has come to be. And in the de Blasio era of mayoralty, this was before COVID, there was a lot of dialogue around the creation of something like this. But then the pandemic hit and it sort of took a back burner. And so when I joined the union just earlier this year, this was something that was sort of in the works. So I'm new to this role. I've been the executive director for 1 week, so I'm still sort of I'm still sort of feeling out the kind of power mapping that we need to do, and that's something the cultural kind of sector is trying to also work on. So we're still in like kind of both like historical and initial kind of launching of this, whereas like the New York Health Act has obviously been trying to get passed for a few years. This is sort of like very distinct, but overall I think there's a lot of support for it. I will say that it is a nonpartisan or a bipartisan sort of agenda because of the increase in gig work, And there's a lot of companies and places in other states that are Republican led that are trying to set up something like this in order to kind of skirt giving sort of fair, like more fair wages or engage in wage substitution. So we're really like trying to bring this to the attention of both Democrats and leaders here in our city so that we can model a sort of plan for freelance workers that really centers the workers and not the corporations or the platforms that we work for. Just let me take a second to read the chat. It looks like
I'm answering.
okay, you're answering. Got it. Thank you for the question though, Melinda. I think that was helpful.
Yeah, Melinda, another thing just to add to that, I mean, a lot of talks that we're having as well as building a coalition, we're finding that it's gonna have to be like a cohesive type of process where, you know, artists may have to, you know, when you're submitting your contracts, you may have to get a 5% increase in the fee of what you're charging in order to cover, and that there may be a need of some type of cost sharing from the city, from the employer, from even the freelancer themselves.
Yeah, I appreciate that. I think, Andrea, I asked a more general question and then you brought up a more specific question that I actually find really interesting. So you mentioned the question of like, how does this fit into a picture of where, we want universal health care? How does that align politically? And then also what you said about the fact that there are, corporations and there are Republican or conservative forces that kind of propose portable benefits models in an exploitative way as well. So how do we build it up in a way that's aligned with, our principles of healthcare for all?
Yeah. To answer your question very broadly and generally, I think that this project sort of fits into a universal approach to healthcare in that it builds capacity for expanded healthcare coverage, particularly through government subsidy, right? We're trying to look at like rules and regulations a lot of times because of a specific law. A lot of gig workers aren't allowed to get healthcare through their contractors because it would classify them as employees. And we believe that workers should have the right to choose to whether they want to be freelancers or employees, and so I think that this project works to like create a experiment or model in probably the largest city in the country, right, for something like this. So I think it's a larger project that kind of will lead to other types of conclusions after we kind of pass it and do it and see how kind of we can deliver more like a more universal approach to healthcare.
Thank you both so much. This is more of a comment than a question, um, but I think I just want to affirm the importance of this specifically for teaching artists. For a while, I was more heavily a teaching artist. I still do it somewhat, but like in lower volumes. And I think especially for dance teaching artists in particular, the physical demands of that are different than performance actually, because there's overuse injuries that are specific to teaching five very basic classes but doing the same thing every time and not sitting down, and also being around kids makes you sick. Kids have germs, they're not good at washing their hands. And most teaching artists are working with multiple organizations to build up a full-time or even like a significant part-time income. So I'm just really excited about that development.
Thank you for that. I agree completely. And aside from that, also, teaching artists and doing this kind of pilot is more than just like an experiment or something that we can use to study and explore larger models. But it's also just like a triple workforce investment in our city, right? In like families, in the workforce, and then obviously to young people. There's a lot of different outcomes that are multiply like health outcomes as well, or positive health outcomes.
Yeah, totally. Thank you all. Thank you so much to all our speakers. I know there was a lot to think about today, and we'll be sending a follow-up email with all of the links in the chat as well as slides and other follow-up materials. So I encourage you to look into both organizations' work, do all the action items for the New York Health Act, and yeah, continue to process this information and reach out if you have any questions. We're going to launch a quick poll about this fieldwide call. All answers are anonymous and just for our own learning purposes. And then once you've done that, you're free to go. Thank you, everybody, so much for being here today.
Thank you.
Thank you.
Thanks, everyone.